Hello, guys. Welcome to another episode with the Hemp Moses. I'm public health practitioner, and I work to support change so that people around me and people around the world can have a certain knowledge to make profound choices and decisions, and as well take control of their sexual lifestyle and general health and lifestyle as well. Okay, of course, this is in the support of the global effort to end disease and pandemic worldwide. So, guys, if you are looking for the latest on HIV and AIDS, you are in the right channel. Perhaps you want to know, you don't know how to go about your testing. If you want to know, you don't know how to go about knowing your status, you are here in the right channel. Of course, I have some videos from my previous videos where I talk about how to go get tested, or how you are to know your status even personally from your room, from your house. You can carry out a test to know if you're HIV positive or not. So you can refer back to my previous videos on HIV testing on this channel. More so, if you are looking for a basic counsel, or let me say truthful counsel on maybe marriage, perhaps you have a partner who is positive and you are negative, and you are concerned about the fact that is it possible for you to get hooked up or get married to a positive patient, or a negative patient, or a positive person or negative person? Okay, well, I'll say you are in the right channel, of course. So if you want such some of those counsels, you can email me via my email at madami.com for gmail at madami for joy.com. And also you can as well drop your message in the chat box, and I will really answer your questions or get back to you as soon as I'm able to see your message. Okay, all right. So guys, if you like my video, kindly give me a thumbs up, and don't forget to subscribe to my YouTube channel. You can as well click on the notification bell so that you can be notified when we have a new video. All right, to my returning to my subscribers, I'll say a big thank you, a big thank you to all of you. I mean, you guys are so amazing. You are so amazing. You are so encouraging. I love you guys. And also to my returning subscribers, you're welcome back on the show. And also, if you have not subscribed to my YouTube channel, if you watching right now, if you've not subscribed to my YouTube channel, kindly click on the subscription button. That's the red right up there. Hit the notification bell, and trust me, you're gonna be alerted when we have new videos. On this channel, we'll be talking about health related issues ranging from children, adults, male, females, and the likes of them. And so therefore, you are welcome to M. Moses channel. Today, like I said from my previous video, I actually talk about HIV treatment, and I made a promise that I was going to talk about the side effects of this HIV treatment. Yes, we are going to be talking about that. So, alright, so side effects from HIV treatment are not inevitable from what I said last time. And if they do occur, they are generally mild, easy to treat, and usually they go away quickly. Okay, so do not be scared. A change of treatment is one of the option for dealing with potential side effects, but it's important never to stop taking treatment without consulting a doctor first. Is that clear? You may be asking, What sort of side effects can HIV cause? Yes. Okay. There are some common side effects which HIV treatment can actually cause, ranging from diarrhea, nausea, or vomiting. Some of it could be headache. You could have tiredness or even rash. Okay, which mean rashes or rash per se. Now, an HIV doctor can select a combination of drugs. Do you get, with a specific intent to avoid or minimize the risk of certain side effects. All right, so that on that regard, so which means that your doctor is really is really concerned about your health, because he would or she would not want to place you on drugs that are going to pose threat to your health or general health. Now, other question you may be asking is, does everyone experience side effects from HIV treatment? Well, it's not inevitable to experience side effects. Okay, plus really, most of the side effects caused by the anti-HIV drugs used today are mild, like I said earlier. Another thing is many side effects lessen or are likely to go away with time on their own without any additional treatment. Okay, also the risk of most side effects is low. Do you get? So you should not be scared whatsoever. It's usually possible to do something about side effects, however, including changing your treatment regimen. All right, so to avoid discomfort, anti-HIV drugs, can sometimes cause longer term side effects. For example, what I mean by that is, some causes increase, some cause increases to cholesterol and other blood fats, or even disturbance in the functioning of the liver or kidneys. Okay, we have lipodystrophy, which is body fat changes, such as losing some fat from the face, legs, arms, or buttocks, or even gaining fat elsewhere, is a side effect of some of these older anti-HIV drugs. Do you get? So these drugs are now avoided as much as possible for long-term use. However, so monitoring for this and other side effects is a part of routine HIV care. Of course, I think in UK, so, and some part of the world as well, where HIV treatment is being taken or is being carried out. A lot of caregivers actually monitor the side effects to ensure that you have a proper healthy lifestyle and you are very comfortable rather. Okay, so is it possible to be allergic to HIV treatment? Oh, yeah. In rare cases, people can develop a serious allergy. Allergic reaction to a drug, So the anti-HIV drugs with the greatest risks of hypersensitivity or allergy are, the abacavir, the abacavir, which is, or you call it the Xiangen, which is also the combination pills of Kivexa and Trizivir. Another one is the nevirapine or the Varamonel. So doctors can carry out a blood test on people who are thinking of taking abacavir to find out whether they have a particular gene. Okay, and this is what puts people at risk of severe reaction, to the drug. And people who have this gene cannot actually take abacaba. Also, in rare cases, other drugs can also, cause allergic reaction, and these drugs include like you have the atazanava, you have entraverine, you have the efavirenz, you have the darunavir, you have fasenprenavir, you have the maraviroc, you have the raltegravir. So if you think you might be having an allergic reaction to HIV treatment, what you need to do is, contact your HIV clinic immediately, very quickly, fast, immediately. Or you go to the accident and emergency unit, department of your local hospital. So if you develop any symptoms that your doctor has told you to look out for when prescribing the first treatment, then you should quickly visit your doctor back again. How do you deal with the side effects when they occur? Well, it's important never to stop taking medication, because that's the most important. Now, skip doses or reduce the intake of pills without first speaking to a doctor, as this creates the risk of developing resistance to several drugs. So your viral load could also be affected, and transmission risk definitely will increase. So don't stop your treatment, just immediately visit your doctor, and then they will know what to do next. How is side effects treated? Well, in most cases, side effects are, worst in the first few weeks after treatment. Of course, like I said, they usually disappear on their own. They can often be controlled with other medications, for example, paracetamol for headache, or Imodium for diarrhea, and the likes of them. So, some people find that they can reduce the problem by taking their medications 2 hours, before going to bed. Okay, so this is what the manufacturers of, for example, efavirenz recommend. So others prefer to take it in the morning to avoid sleeping disturbances, which can include bad dreams. So also, it's good to know that a lot of emotional and mental health support is available at your clinic. So either through your clinic, your doctor, or through local HIV organizations. So you can get whatever treatment you are looking out for. Exactly. So I also said I was going to talk about resistance and changing your treatment. Well, resistance and changing your treatment. Taking HIV treatment properly is important, my dear, because poor adherence can lead to the development of drug resistance. Developing resistance can cause your anti-HIV drugs to stop working for you. Okay, and you may need to change your treatment. So you have to take your treatment very, very serious and important. If you don't want to start changing from one regimen to another regimen, because the next regimen might not be palatable at all. So you need to keep taking your drug regularly. So why would I need to change my HIV treatment? Yes, there may be problems with the drugs we are currently on. If one, they are not keeping your viral load down, you need to change your drug. If your virus is resistant to them, that means to the drug you're taking, you need to change them. And again, if the side effects are too difficult for you to manage, then you need to change your drugs or your treatment. Again, if the drugs have to be taken at times that, you know, that doesn't suit you. I mean, periods that does not suit you. Maybe you work with machineries, you have to, you're busy, you know. Some of the drugs can make you drowsy, can make you sleepy, so you might not like to take drugs during that periods. So you can change your regimen. Just talk to your clinician, or adherence officer, as the case may be. Then they will, even your pharmacy, so they can, counsel you and guide you what to do next. And then also, sometimes you may have to change your drugs if they don't interact well with your drug. You take for another condition. What I mean by this is, there are times whereby the drugs you're taking, maybe you have certain different ailments. Take for instance, maybe you have diabetes and you're, HIV positive. It's the drug you might be taking for HIV might you not be compatible with that diabetic drug. So what do you need to do? What you need to do is to meet your adherence officer, your pharmacist, or your clinician, and or perhaps, or most importantly, your doctor. You just talk to them, and they are going to proffer you solution. And trust me, I believe by the time you're changed to another regimen, it should suit your body system properly. So, what is HIV drug resistant particularly? What does that mean? All right. What does that mean? Personally, I know some of you might be asking. Now, resistance is a term doctors often use. It means that some HIV cells mutate and carry on reproducing despite treatment. I'll come again. I'll take it again rather. Resistance is a term doctors often use, which means that some of these HIV cells mutate and carry on reproducing or reproduction despite the treatment, so they don't stop. Now, every time HIV makes a new copy of itself, it ends up slightly different. Get that straight. Often these differences are not, important, but sometimes the new copy is different in a way that is resistant to the drugs you've been taking. Okay, so this means that it will be able to reproduce again even when you take the drug. Exactly. Please listen to this video over and over again for you to understand. Now, how does resistance to anti-HIV drugs develop? Yes, resistance can develop if you don't take your HIV treatment as prescribed at the right time. Okay, every day you have to take your treatment often, so as to properly adhere. All right. Now, it is possible to have resistance to some drugs even before you start HIV treatment. You may have been infected with a strain of the virus that is already resistant to some of these anti-HIV drugs. Now, if that occurs, you need to go back to your doctor. Exactly. There are actually tests to check whether your strain of HIV is resistant to any HIV drugs actually. So if you're taking combination therapy, it is important to make sure that enough of the drugs are in your blood all the time, enough of the drugs so that they can do their job properly. Okay, missed or late doses could mean that there are reduced level of the drugs in your blood. So this can allow the virus to make more copies of itself, including drug resistant copies. So guys, I'm going to be rounding up here for today. If you love my videos, kindly give me a thumbs up and don't forget to click on the subscription button so that you can get notified when we release the next video. And so in my next video, I'll be talking about what does it mean if resistance develop. I'll be talking about what can be done if you develop resistance, and how the new treatment combination can be chosen, guys. So stay tuned in my next video, and don't forget to share this lovely video, wonderful video, to your friends and loved ones so that they can be in the knowing of what is going on as per HIV and other diseases and pandemic in general, other healthy you know, lifestyle awareness. So see you in my next episode. Do have a wonderful day. Bye.